All right, so hello and good evening, everyone. Thank you so much for joining our webinar, Managing Urolithiasis in Cats and Dogs, Diagnosis, Prevention and Treatment Strategies. I'm Dr. Thanusha, the technical vet from Pets Corner, and I'll be your moderator for today. Before we start, let me run through a few house rules. Please ensure your mic is turned off throughout the webinar. If you have any questions, you may put it up in the chat box and I will read it out to the speakers at the end of the webinar. We do have Kahoot quiz at the end as well, so please pay attention as the first 3 winners for Kahoot will get grab vouchers worth up to 200 ringgit. And please stay till the end of the webinar in order to get your CPD points and also your certificates. So without further ado, I would like to introduce our first speaker for today, Dr. Xavier. So he graduated in veterinary medicine from Universitat Autònoma de Barcelona, UAB, in 1989. He is a diplomat of the European College of Veterinary Internal Medicine, specializing in small animals in 2004. He is a member of IRIS and current president of the Canine Leishmaniasis Study Group. Since 1990, he has worked in the internal medicine service at a hospital, and he has been a visiting veterinarian in the hospitals of Ohio State University, North Carolina State University, and the Animal Medical Center in New York. He has presented papers and lectures at national and international congresses, seminars, and has published over 90 scientific articles, both nationally and internationally. His work and research focus on internal medicine and infectious diseases of dogs and cats. So without further ado, Dr. Xavier, the floor is yours.
Terima kasih, Thanusha. Thanks to be here. It's a pleasure, and I'll try now to share my presentation. So I hope it would be nice. Perfect. And okay, I think it's right. So if you hear me perfectly, and so thanks very much, Thanusha, and thanks also, especially thanks to Advanced Veterinary Diets for the possibility to be here, especially as Thanusha and Alba that we will meet later. It's a pleasure and good night to be here for you. Here is afternoon, there is night, and I will talk about the management of urolithiasis in cats and dogs. As Thanusha say, I am internist, so I will talk about the medical management of urolithiasis in cats and dogs. So I will give an approach of the management of this clinical situation, and now at that time talking about 5 topics or 5 important ideas that we need to know in order, as a clinician, in order to manage this kind of clinical situation. The first topic or the first important idea is to know what we know and what is the importance of a urolithiasis in dogs and in cats. And of course, the last consensus, international consensus about the management of urolithiasis in dogs and cats is from 2016. So in that consensus appear more or less the same recommendations that I will talk now, because the science, this consensus doesn't appear any new consensus or any new advice about the control, the management, treatment, and prevention of urolithiasis in dogs and in cats. It's true that in this period, close to these 9 years after this publication, hasn't appeared many new information about the new technologies in endoscopy and lithotripsy in order to treat from a surgery point of view the urolithiasis in dogs and cats. But this is not my specialty. I am internist, so I will talk just about the medical management. So I will be about this. I will talk about this. Urolithiasis in dogs and cats is an important clinical situation, and all of you and also me, we have many cases in dogs and cats where we need to manage this urolithiasis. We need to know that from a medical point of view, one of the most important ideas is understand that the formation or precipitation of the uroliths is due to an salt oversaturation in urine. So this means that before appear uroliths, always we have first crystals. And this is important because the clinical signs associated to the presence of this clinical situation are secondary to uroliths. Crystals don't produce lesions in the uroepithelium, don't produce urinary infection, don't produce obstruction, don't produce any clinical sign. So when we have these clinical signs, and these clinical signs are associated to uroliths, means that we have real uroliths. So this presence of the uroliths could produce obstruction in the urethra and the ureter, so could produce several other adverse effects or problems associated to this, and could produce several chronic injury that in sometimes became a complication with urinary tract infection. So the urinary tract infection could predispose that we can see more other clinical signs. In general, these uroliths are located basically in the lower urinary tract, so urinary bladder and urethra. And only between 5 and 10% you find this kind of uroliths in kidney or in the ureters. In general, we accept that now around the world, most of the more than 80% of the uroliths in dogs and cats are or estrubite or calcium oxalate. And then we have several other kinds or types of uroliths, like could be from urate, mixed, silicate, or even xanthina, could be other kinds of uroliths associated with this predisposition. This situation, global situation that in general is frequent, most of them are in the low urinary tract, and the most important are estrubite and calcium oxalate, is also the same in your country, in Malaysia. And this study from the University of Putra demonstrated in 2017 that more or less you have the same situation. So, of course, even in dogs and in cats, we have a high percentage of the uroliths in the lower urinary tract. So this means in bladder and urethra. And both most important uroliths are estrubite and calcium oxalate, more or less similar percentage, but it's true that calcium oxalate more frequent in cats and estrubite more frequent in dogs. But in general, we have the same situation that the consensus explained in 2016. When we talk about urolithiasis, we need to understand that in dogs and cats, what are the most important factors that need to be treated or need to be managed in the future as these predisposing factors to the presence of urolithiasis. And of course, the high quantity of crystals is one of the predisposition factors that could produce the urolithiasis. In this sense, one of the most important is the decrease in the tubular reabsorption. So this means that most of the times, the problem is genetics. So each dog or each cat lost more or less crystals in the urine, and this predisposition is the problem that could develop with the pass of the time, the presence of this urolithiasis. So this means that many breeds in dogs, for example, Schnauzer or Yorkshire Terrier, could be genetically predisposed to the uroliths, for example, calcium oxalate uroliths, or, for example, Dalmatian could be predisposed to uroliths, or Bulldog could be predisposed also to the urate or cystine urate, or in cats, for example, Persian cats could be predisposed to the presence of this calcium oxalate. So different breeds could be predisposed due to this decrease in tubular reabsorption of these crystals. Second important factor is the diet. So diets that are rich in minerals or diet that are rich in protein could predispose to the increase of the crystals, and then could predispose to the concentration of these crystals producing an urolithiasis. The third point, and very important, is associated to the urine rotation and decrease of the water intake. So basically about the urinary specific gravity. So the concentration of this urine, more concentrated, more predisposing factor to produce urolithiasis. And finally, only in dogs, males and females, urinary tract infection could produce an increase of the crystals of estrus beta, so an increase in the supersaturation. So both situations predispose to the production of the estrus beta urinary urolites. So these are more or less the most important predisposing factor, and also important because the management could be the evaluation and the control of these different factors in order to reduce the treatment or the prevention of the urolithiasis from a medical point of view. So to know about the urine and to know about the location are main factors in order to decide what is the best treatment for each dog or each cat in front of urolithiasis. In this situation, urinalysis is basic. Urinalysis is important, especially to evaluate the cytology, the sediment of this urine. And also it's important, if you cannot do the urinalysis immediately after obtaining the urine, and you put the urine in the refrigerator, remember that maximum 24 hours, but also before to do the urinalysis, you need to put the urine at room temperature and increase the temperature of this urine in order to do an excellent or adequate evaluation of the urine. Cytology is very important. We also need to do a urinary test strip. But in order to evaluate these factors that are important in the urine for the development of urolithiasis, you need to understand that the urinary test strip is not very useful. For example, the urinary specific gravity, that is important in order to decide the predisposition to produce or not urolithiasis, is not possible to evaluate with the urinary strip. We need to use a refractometer in order to obtain this value. And also the evaluation of the infection could be done by urinary test strip, but the efficacy of this test, so the efficacy to look for leukocytes, nitrates, or urinary lesion are not very adequate in dogs and in cats. So at the end, when we use the urinary test strip in the urine, probably the most important thing will be the evaluation of the pH of this urine. The rest of the information in the urine could be for the sediment, for the cytology of this urine. And it's important because we will look for the different crystals and the quantity of these crystals, and to look for other kind of information. But you need to remember that to find crystalluria in the dog or in the cat in the urine doesn't mean that are the cause of these clinical signs. Remember that crystalluria don't produce clinical signs, but crystalluria inform us about the risk or the type of the urolith at this time in this dog or in this cat. The sediment also gives us a lot of information about inflammation, infection, and the type of the cells that we can find in the urinalysis. So you can make a kind of decision if urolith is the most important problem, or we have other problems like, for example, neoplasia or urinary tract infection. And finally, remember that the evaluation of the urine in room temperature is basic in order to avoid the presence of in vitro crystalluria that for us could produce a misdiagnosis of crystalluria, a misdiagnosis of potential urolithiasis when this crystalluria has been produced in the fridge. Together with the urine, we need also to know where is the urolithiasis, because we thought that the crystalluria is not the problem, the urolithiasis is the problem. So it's important to know if these uroliths are in the urinary bladder, like this or like this, are, for example, in the urethra, so this part is in the low urinary tract, or this urolithiasis is located in other places in the upper urinary tract, so in the kidney, the pelvis of the kidney, or in the ureter. This is very important because the treatment will be secondary to this situation and secondary to this information that we have obtained in the urine. Finally, urolithiasis, one of the most important ideas that we need to understand, that is the urolithiasis is associated to this concentration of the oversaturation of the crystals of the urine, producing the possibility to create a urolithiasis. So the relative supersaturation index is basic in the medical and prevention treatment in order to reduce this index. And this index is associated to urinary specific gravity, to amount or quantity of crystalluria, and type, of course, and finally depends of this urine pH. So this information that we have taken from the urinalysis, also together with the information about the situation of these uroliths. With this information, we can go ahead and go to the second important point, that is the medical treatment, the medical management treatment of the urolithiasis. It's important that when we start to treat the urolithiasis, we need to be sure that is the main problem of this dog or this cat. Imagine some dogs and some cats that arrive on the clinics with hematuria, white cat with hematuria, but when we do the different location, looking for the location of the uroliths are located in the pelvis, urinary pelvis, and in the kidney. So if it's in the kidney, the probability is that this real hematuria or this evident hematuria, together with other clinical signs like stranguria, pollakiuria, pain, and when the dog and the cat try to make urine, in this situation, the urolith is present, of course, in the kidney, but the clinical signs are not associated to these uroliths if we don't find other uroliths in urethra or other uroliths in the urinary bladder. So they mean that in this cat or in this dog, maybe this cat have urolithiasis in the kidney, but the main problem is an idiopathic cystitis, feline cystitis. Or in dogs, maybe you have urolithiasis, but it's a male dog, and the problem in this case have the urolithiasis in the kidney, but the dog have a prostatitis or a benign hyperplasia, prostatic hyperplasia. So this situation is important. We talk about medical treatment, it's also important to individualize the treatment. So it's not the same for a dog, for a cat. It's not the same if it's urate or if the urolith is struvita. It's not the same if the dog also is atopic or need to eat another kind of diet is not the same if it's in the lower part of the urinary tract or is in the upper part of the urinary tract. So there are many information that we need to use in each dog and in each cat. And so the treatment and prevention especially are divided into options. When the urolithiasis is in lower urinary tract, so urethra and bladder, and when it's in upper urinary tract, kidney and ureter. When we talk about medical treatment, the other thing is the medical treatment only works if the urolith is in the renal pelvis or the urolith is in the urinary bladder. If not, doesn't work the medical treatment. Why? Because the urolith need a close contact with the urine during several weeks in order to have an effect in the reduction in the size or even try to eliminate or dilute this urolith. The uroliths in ureter or the uroliths in urethra need to transfer to the urinary bladder if we want to eliminate or if we want to treat or if we want to prevent when we have an urinary, when you have an urolith, because they need to be transferred to the urinary bladder. And finally, the size is also important because when the urolith is bigger, means that we need more time in order to obtain the results, and sometimes means that maybe the urolith is a mix of different kinds of minerals, different kinds of crystals, so sometimes with the pass of the time we need to change from one treatment to another treatment. Uroliths in dogs and in cats, more than 80%, close to the 90%, are produced by calcium oxalate or estrubite. So in general, have radio opacity, so we can look them in the X-ray, but estrubita have a low density, low radio opacity if you compare with a calcium oxalate. But when we look for the uroliths in the upper urinary tract, more than 90% of them are calcium oxalate. So if we cannot see, or you just see a kind of suspicion of estrubite in the upper urinary tract or obstruction in the upper urinary tract, but we cannot see the urolith in the X-ray, means that probably is rarely estrubita, so probably we usually have clots. So clots could be a kind of obstruction, could be a kind of problem in the ureter, but is not an urolithiasis. So the change of the diet need to be evaluated carefully. When we talk about medical treatment, we have two objectives. The first objective, transfer them to the urinary bladder. So if they don't are in the urinary bladder, are in the ureter or in the urethra, we need to put them there. And the second, if there's dissolve them. And in order to dissolve them, the uroliths need to be or in the urinary bladder or in other situations like the renal pelvis. If not, it's not possible to obtain the results of the medical treatment. Goes to the third important idea. It is the transfer the uroliths to the bladder. Transfer them, when we talk about urolithiasis, is important because if we have in ureter, urolithiasis in the ureter or urolithiasis in the urethra, could produce obstruction. And obstruction is an important and a severe and urgent clinical situation because can develop secondary other problems like urethra, bladder, ureter rupture, or, for example, ureter stenosis or stricture, or hydroureter or hydronephrosis, or finally even can develop a chronic kidney disease due to the difficulty in the glomerular filtration rate, so in the decrease of the production of the urine. That means that we need to transfer as soon as possible these uroliths in order to, for one side, treat and second, in order to prevent obstruction or other problems. Transfer the uroliths from the urethra to the bladder is quite easy. The problem in general is from the urethra to the bladder. This is more complex because we don't have devices, special devices like different kinds of urinary catheters that allow us with the use of serum, with the use of physiological serum, in order to push this kind of uroliths from the urethra in a dog or in a cat to inside the urinary bladder. The most complex is from the urethra to the bladder. Fortunately, this is less frequent in dogs than in cats, but in cats it's quite a common important pathology. So even it's not exclusive of the cat, and we can find urolithiasis, ureterolithiasis, so urolithiasis in the urethra in dogs, most of the experience and most of the publications is about just the medical treatment of urolithiasis in urethra in cats. But probably we use the same treatment in dogs if you find urolithiasis. A recent paper in 2023 talked about the treatment of the urolithiasis in cats in order to just medical treatment in order to send these uroliths to the urinary bladder where we can work with them or we can treat them. The efficacy of the medical treatment is quite low, and in general is about 50%, and especially associated to the size of these uroliths. So in uroliths, at least less than 5 millimeters could be interesting and could be useful, this kind of treatment. But the other thing, when we try to put this urolith to the bladder again, this problem doesn't be sure that we can obtain a reduction of the azotemia. So it's important in order to treat the urolithiasis, but we don't know if with the treatment, with this kind of treatment, transfer the urolith from the urethra to the bladder, we can obtain the results of a decrease of azotemia. Sometimes we need to wait for other days in order to obtain these good results in the decrease in the azotemia, and sometimes we cannot obtain this reduction of the azotemia. The treatment for the medical treatment for the urolithiasis is basically based in fluorotherapy, relaxation of the urinary tract, analgesia, antibiotic, and prednisone. In this situation, the most important treatment or the more useful treatment is the use of fluorotherapy in order to increase the diuresis, the pressure, again, pushing this urolithiasis in the urethra, the analgesia, and the prednisone. There are more discussion about the use of these urinary relaxators like prazosin or tamsulosin. These are the doses in dogs and in cats, and even the use of antibiotics in the treatment of the acute urolithiasis in the urethra. So maybe when the urethra, if there is infection, when we can move this urolithiasis to the urinary bladder, maybe there is when we can start with the antibiotic. But in general, we can use as a medical treatment this kind of management. But you need to be fast, because with total or partial obstruction of the urethra, we have a clear decrease of the glomerular filtration rate. We have an increase of the azotemia. So we need to go fast, because if not, in general, we lost part of the function of the kidney, so we have an increase of the urinary, of the azotemia. So maybe after the treatment of the urolithiasis, the kidney disease remain. It's true that sometimes could be this obstruction could be maintained for several days without any alteration of the glomerular filtration rate. But this situation is always in partial obstruction. So we will have a minimal suspicion of of total obstruction. We need to go early in the treatment. So means that we need to be early in the diagnosis. So means look for the distension of the pelvis. The urinary pelvis is easy to decide. Here we have a small decrease of the urinary pelvis, so there is not obstruction. And here we have a height increase of the urinary pelvis, so we talk about obstruction. But when we have in the middle, so about 7 millimeters, we have many doubts in there is or not obstruction, especially in the cats. So we need to have an early diagnosis, usually ultrasound, but knowing that not always is possible to make a clear diagnosis. But if we found a high increase of the pelvis, we have sure obstruction. But if we have more than 7, probably we have obstruction. And we have between 5 and 7, sometimes we have obstruction. So in this situation means that even is not sure that we have obstruction, maybe could be interesting treat like obstruction in order to obtain a better results in the solution of this urolithiasis, or at least to be sure that if there is a urolithiasis, we need to decrease the probabilities of this partial or total obstruction. Sometimes it's not possible with medical treatment obtain the transfer from the uroliths from ureter to the urinary bladder. In that situation, could be interesting the use of subcutaneous urinary bypass or the stents in order to improve the azotemia, in order to have more time decreasing this azotemia that is increasing because have obstruction, and with the medical treatment is not possible to move this urolith from the ureter to the urinary bladder. Both stent in general give more complications than not the use of subcutaneous urinary bypass. So in general, with more frequency, we are using in dogs and in cats the sub instead that the use of the stents. And in practice, is very interesting the use of the bypass on stent if we have a real obstruction with either ureter or hydronephrosis. If we cannot transfer the urolith from the ureter to the urinary bladder between 48 and 72 hours, and also when we have azotemia, worsens this azotemia even with the use of fluids. It's controversial the use of bypass or stent when we have a chronic infection or when we have an increase of the size without a real obstruction. So if we don't have a real obstruction, another increase of the size of this urolith. And finally, probably is not useful a bypass or a stent when we have an exacerbation, when we have a cat or a dog with iris 4 with a severe chronic kidney disease, and we have this exacerbation of this problem, a problem of obstruction, when we know that this cat or this dog have a previous urinary chronic kidney infection. So maybe infection disease. So maybe this dog or this cat have not a good response to the when we use a bypass or a stent. The second objective to do with the medical treatment first is move the urolith to the blood or to the bladder, and second is the second objective is dissolve these uroliths in bladder or in pelvis. We know that always that we have an urolith, we need to do a urinary culture because the urolithiasis sometimes could produce this infection, or sometimes the infection in dogs males and females, could be secondary to this urinary infection, what is the case, for example, of the struvite urolithiasis. So to make this kind of culture is important in order to decide if we will need antibiotic or we will not need antibiotic. Not all the urolithiasis need antibiotic as a treatment. We can obtain the urinary culture by cytosynthesis or by phylosynthesis, and it's important that sometimes could be negative because in the urine there are not infection, and the infection is in the urolith or in the biopsy. So if we cannot do a surgery, or when we make maybe a surgery in order to withdraw this urolith from the urinary bladder, maybe it's the time to take the urolith and send, in order to know the composition of his urolith, but also send to make a culture, and probably will be interesting also take a biopsy in order to look for this infection in the biopsy of the urinary bladder, in the mucosa of the urinary bladder. The medical treatment, so dissolve them in the pelvis or in the urinary bladder, is an effective treatment for struvite, urate, and cystine urolithiasis. But for example, for struvite, for calcium oxalate urolithiasis, or for example, xanthina urolithiasis is not effective. So this means that before the treatment, the medical treatment, is necessary to pull out or to break this urolithiasis by lithotripsy or by surgery, take out of the urinary bladder or out of the urinary pelvis in order to use after this the treatment. Because the treatment, the medical treatment in oxalate calcium, for example, is also useful for the prevention. So in order that doesn't appear a new urolith with the pass of the time, or in order to maintain with a small size, for example, this urolith in the pelvis, in the renal pelvis, without more increase of this urolith, so could produce with the pass of the time more problems. In the nephroliths, the efficacy is lower than the urinary bladder because, of course, the time that spent the urine in the pelvis is shorter than the time spent the urine in the bladder. So the action of the urine, that is our treatment, could be less effective when we talk about renal pelvis. And for the treatment, for dissolve or for prevention, these uroliths, we remind the first important idea, relative supersaturation index. And our objective is to reduce the relative supersaturation index. And this we can obtain through the reduction of the urine-specific gravity, the reduction of the amount of crystalluria in the so the crystals in the urine, and adequate control of the urine pH. So go to the last point of this talk about the relative supersaturation index. So what is the medical treatment to obtain the reduction of the relative supersaturation index? So look for the reduction or the dissolve the urolithiasis, or if not, at least to decrease the progression, to decrease the growing of this urolithiasis. So decrease the clinical signs associated or the potential obstructions associated to this urolithiasis. In this point, we talked before that the reduction of the relative supersaturation index, one of the most important is the reduction of the urinary specific gravity. We need to obtain in dogs or cats, we need to obtain a urinary specific gravity, a concentration of the urine about 1022 or less. And we can obtain this increasing the water consumption. So we can give different fountains in the cats, you can give more water to the dogs, but sometimes this is difficult. And in dogs and in cats, probably the best increase of water consumption, so the best treatment in order to reduce the urinary specific gravity is the use of prescription diet or wet prescription diet, or a mix of wet plus dry prescription diet, or the use of only prescription dry diet but mixed with hot water in order to increase the amount of water that the dog and the cat obtain when they eat. Sometimes we can obtain this reduction of the urinary specific gravity, so we obtain this increase of water consumption using other kinds of diets, because sometimes we cannot use a urinary prescription diet for the cat, or a urinary prescription diet for the dog, because maybe this dog or this cat have other problems. For example, a chronic enteropathy, or for example, mellitus diabetes, or for example, an allergy, and a dermatological allergy like atopy. So in this situation, maybe they need other kinds of diet. But the idea is the same. Use wet prescription diet for the intestinal problem, or you use a mix of the prescription diet for the enteropathy, dry and humid, or you can humid this dry diet, in this case, and diet for the enteropathy, but you need to decrease this urinary specific gravity. The second point is to reduce the crystalluria. To reduce the crystalluria, of course, for reduction of crystalluria, the most important treatment, the most efficacious treatment is the use of prescription urinary diet. Use the diet adequate for the kinds of crystals in order to reduce this production. Reduce the production, because it doesn't mean sometimes that we can avoid the production of crystalluria. We reduce the quantity because we need to reduce the relative supersaturation index. Sometimes we say that one of the predisposition factor is the genetics, and we can never control this part of the genetic. So we cannot control the loss of crystals in the urine forever, but we can reduce the quantity with the use of this prescription diet. Of course, if we have a urinary tract infection in dogs, we can treat this urinary infection in order to reduce the crystalluria. If we have calcium oxalate as a potential urolith, the treatment of hypercalcemia, if it's present, is also interesting. Or if we have urate, we need to evaluate different kinds of hepatopathies. For example, shunt, portosystemic shunt, or for example, other kinds of hepatopathies like cholangitis. And if we treat this kind of problems, you can reduce the quantity of urate crystals. Or, for example, if the problem is cystina, we can try to neuter or spay or castrate the dog in order to decrease the quantity of cystina. Or even, together with the prescription diet, we can also use other treatment, like, for example, mercaptopropionate glycine in the treatment of the cystina, or the use of thiazides in order to decrease the quantity of calcium oxalate crystals. Always together with the prescription diet. Or if we have urate together with the urolithiasis, the urinary prescription diet, we also can use allopurinol in order to decrease the quantity. Reduce the quantity. Sometimes we can avoid the presence of crystalluria, but decrease the quantity, reduce the relative supersaturation index, so produce less risk to develop a urolithiasis. The problem is the urolithiasis. The problem is not the crystalluria. So we treat the crystalluria in order to avoid the urolithiasis. And finally, the relative supersaturation index, the control of the pH. Of course, here, the best treatment to control the urinary pH is the use of urinary prescription diet. The problem that is that this urinary pH is very variable, is not always perfect. The result of the use of prescription diet or even other treatment in order to obtain this pH adequate for each one of these kinds of urolithiasis. So is an important factor, but is the third important factor. And in general, only using prescription diet is enough in order to have a close, perfect urinary pH. In estrubate, of course, less than 7. In oxalate or urate, maybe more than 7. But even if we can obtain this, the use of prescription urinary diet is the better way or the better treatment in order to control this urinary pH. Sometimes, together with the urinary prescription diet for dogs or for cats, we can use other kinds of treatment in order to, for this driver, make a more acidification or the use of potassium citrate, for example, in order to obtain more alkalinization. So depend if you want to increase or decrease the pH together with the prescription diet. If not enough with the prescription diet, we can use this kind of other treatment. These are the dose for dogs and for cats, and this is the dose for dogs and cats at the same time. So finally, the treatment of prevention is medical treatment and medical prevention of the urolithiasis is reduce the relative supersaturation index. So reduce the specific urinary gravity, reduce the amount of crystals, and finally also try to modify the pH that is better or less in order to dissolve these crystals. But these need times. So we need to obtain good results after 4-8 weeks, so at least 1-2 months before to start to think about other kinds of treatments for example, surgery or lithotripsy. If we obtain the results after 4-8 weeks, we need to maintain the diet at least 1 month after the total dissolution. And we need to avoid, in this period, the use of invasive surgeries in order to, these kinds of diets are not many adequate for a good cicatrization, a good health of the different lesions associated to the surgery. Nephrolithiasis sometimes is less effective than urolithiasis in the bladder, remember, and sometimes we cannot use the urinary prescription diet because these dogs or these cats need other diets, or sometimes there is obstruction, so we cannot wait for 4-8 weeks, or may have chronic infection. Sometimes we need the use of the diet, but we need other kinds of treatments in order to obtain these results. And the last important idea, the adequate follow-up. So a dog or a cat with urolithiasis, with a diagnosis of urolithiasis, with treatment of urolithiasis, and with prevention of urolithiasis, you need to do a good follow-up because we cannot avoid 100% the possibility that relapse again with a new urolithiasis. So we need to check the urine at least every 3-4 months in order to evaluate the urinary specific gravity, the concentration of the urine, the amount of crystals, the type of crystals, presence of infection, pH, and other things. And second, approximately every 6-8 months to do an abdominal ultrasound in order to be sure that we can detect an early diagnosis of potential urolithiasis, so we can do an early medical treatment, medical prevention, other kinds of treatments in order to avoid the potential consequence of obstruction in the ureter or in the urethra in secondary to urolithiasis in dogs or in cats. So we arrived to the end of this seminar, and the most important idea is that we need to use and prioritize individualized medical treatment in dogs and cats with urolithiasis. So each dog and each cat with urolithiasis, the same urolithiasis, sometimes need different treatments. And the control of the urine, the decrease of the sobresaturation index, the reduction of the size, the reduction of the urinary specific gravity is very important. And in all of this medical treatment, the use of the a urinary prescription diet is very important. So tenim a Casic, and now I think we have some minutes in order to answer some questions. And if not, I could answer them. If we have many other questions, I could answer later by mail, and you can receive from Advance, from Affinity, these answers. Thank you very much.
Thank you very much, Dr. Chawi. I think we will answer all the questions one shot after Dr. Alba's talk. Is that okay, Doctor?
Perfect.
All right. Thank you so much, Doctor. So next, I would like to introduce our second speaker, which is Dr. Alba Martos. So she is a dedicated professional in veterinary medicine, earned her degree from UAB in 2011. From 2011 to 2020, Dr. Alba, she was a corporate product manager at HIPRA. And later on, she continued her MBA from a business school in Barcelona in 2021. And currently, she holds an esteemed position of International Veterinary Manager at Affinity Petcare. So without further ado, Dr. Alba, the floor is yours.
Thank you very much. I hope you can see my screen. Is it fine?
Yes.
Okay. So, well, good evening for everyone. Well, first of all, thank you, Thanusha and Petscorner to give me the opportunity to present the advanced diets coming from Affinity. So I'm, as Thanusha said, I'm the vet in the company. So I will share with you a short presentation about what is advanced and especially how or which diets we have to support all the diseases that dogs and cats have, also the urinary problems that Xavier was talking about. So first of all, I would like to introduce Advance. I'm pretty sure that almost all of you know what Advance is, but I think that it's quite important to remark that Advance is a brand that is somehow new in Malaysia. So we arrived last year to the country, but in fact, it's a very old brand, at least in Europe. So we have been for more than 25 years working with these products and especially with the vet diets. And our purpose in all these years has been to protect the dogs and cats. So for sure, the vet diets, they have a special purpose, each one, but also for those products that are not a vet diet, we try to give something extra in the pet food to protect them, to reinforce the immune system to be protected against any infection or any possible pathology that they can have. And with that sense, we have been relaunching all the brand last year and also now this year. So with that, we are reinforcing this main objective that is, as I said, to protect the dogs and cats from any infection or pathology they can suffer. And we are using the nutrition for that. So why advanced, right? Because for sure there are many brands in the market. Maybe for the diet it's not so high, but I think that it's important to understand why we are confident of this brand, and also we encourage you to try it, because for sure this brand will help you to improve the nutrition of your patient, right? So when we are thinking of advance, we are just summarizing all the points in 5 groups. So the first one is the formula. So for sure we are talking about nutrition, so we have to take into account the formula. The second one is the healthy microbiota. So as I said, we have been relaunching the brand. So more and more we know that the microbiota is related with the general health of pets, but also for humans. So we have been improving our formulas, for example, including probiotics to reinforce that microbiota. The third block, it's obviously we have to have products that are adapted to all pets. So we have to be adapted to a mini dog. If it's a puppy, it's adult, to a cat, if it's sterilized, not sterilized. So for sure, we adapt all our products to the kind of dogs and cats you are receiving in your clinics. The fourth block is a palatability. So I think that this one is really, really important in veterinary diets, because nothing has sense if the palatability is not good. So we are working in improving every day the palatability. And the fifth block, it's the science. So we are in front of a brand that it's providing nutrition, let's say the maintenance nutrition, but also the diet. So for sure, we have to have many trials that reinforce everything we say. So for sure, we have a strong science behind, and especially for the vet diets, any claim or anything that we are saying, it's supported by a trial or some trials that we have been doing. So if I move to the first one, just to summarize, on the one hand, all our formulas have high quality ingredients. And here I would remark the fresh meat as the first ingredient, because I think that it's quite important. And on the other hand, we are working, or we have what we call active defense. That it's active defense. It's a group of ingredients, including probiotics. That it's somehow very innovative, because we are I think the only ones that are including probiotics in all our formulas. And is the main objective of that is to improve the microbiota, with the aim to improve the health of dogs and cats. So this is the first point. So I think that the formula, the kind of ingredients that we are using, are quite important. So that's why we are using fresh meat as first ingredient, but also we are reinforcing the formula with some extra ingredients like probiotics that will push the quality of the formula. So if I move a little bit for the kind of meat we are using in the formulas, here for sure you know that in pet food, meals or dehydrated proteins are the same, are quite used in pet food. But in advance, we are using the fresh meat as first ingredient, because we know that the fresh meat it has a higher quality, and it has also a higher palatability and a higher digestibility. So that's why we are pushing the fresh meat as first ingredient in all our formulas. And in that sense, in terms of the quality of the formula, this is a point that we have to take into account, because it's somehow good for the ingredients we are using, and it's good for the nutrition of the dogs and cats. Also, I said before that we are adapting all our products to all the kind of dogs and cats. So for the different products, we are using functional ingredients. It means that we are including ingredients that are specifically designed for those dogs and cats. For example, for puppies and kittens, we are including nucleotides that they are simulating the colostrum from the mother. So in that sense, we reinforce the immune system of these kittens and puppies. And another example, are the products that are for senior dogs and cats, where we are including hyaluronic acid and chondroitin that they reinforce the joints. We know that those kinds of dogs and cats, they suffer osteoarthritis, so that's why we are reinforcing these formulas with those functional ingredients that what they do is to reduce the pain, and these dogs and cats can feel better in the sense that they can move easily without pain. So these are just two examples to share with you how we adapt all our products to the specific needs of the dogs and cats, but for sure each one will have its own functional ingredients. If we move to the active defense, as I said, it's somehow very new. We relaunched the brand last year at the end and the beginning of this 2024. And with this innovation on the formula, we have been including probiotics, prebiotics, and fibers to reinforce the microbiota, because now there are many studies that says that microbiota has a crucial role in our health. Even, for example, in some, let's say, for example, neurological diseases that it seems that they are very far away from the microbiota, it seems that even this kind of diseases can be at least reduced when the microbiota is healthy. So, including this active defense with these ingredients that reinforce the microbiota, we will have healthy microbiome. The intestine will be healthy with the cells in very together without the mucus that is normal being produced in the intestine. And in that sense, first of all, we will provide the dog and cat from any infection. And the second step, if we have this intestine pretty good, for sure the general health will be better, and for sure in that sense we will be able to at least to prevent or to reduce the risk of other diseases that are quite related with the microbiota. So we have covered the two first points. So the third one is that the adaptability to the all pets. So in that sense, Advanced has three ranges. The basic one is the maintenance range. So it's that range that it's a typical range, let's say. The range is the one that is for puppies, adults, and senior dogs and cats. Then we have the specialty range. The specialty range, it's a range that it's not a vet diet, but at least it's, let's say, one step more than the maintenance product. So in that case, in the case of dogs, we have sensitive, light, and breeds products. And in the case of cat, we have sensitive and herbal. So those products are not a veterinary diet, but they have somehow a special objective for some special needs. And then the more technical diets we have are the veterinary diets. So we had an example from the Xavier's presentation, like urinary diet. So in that sense, for sure, we have those diets for dogs and those diets for cats. So as I said, for all our products, we are adapting to the formula. So it's not the same to have a puppy that to have an adult. So here you have the main objectives that a product, a diet has for puppy, for example, or for adult cat. So for sure, a puppy is an animal that it's growing. So we have to reinforce the bone development. We have to reinforce the neurological development. And when we have an adult, for sure, the needs are quite different. We have to, especially, for example, if it's a cat, we have to take care of the pH of the urine. We have also to take care a lot about the skin and coat, so that the ingredients and the nutrients that we have to include in the product, in the diet, are quite different. And when we have a senior cat or dog, so we have to take special care of them. So even we are not using a diet, that the maintenance products are including some special ingredients, like I said before, like hyaluronic acid or chondroitin, just to prevent that they suffer from pain because of the age, right? So here you can see how we are adapting all our products to the needs of dogs and cats. And here we have an example of a sensitive product. Sensitive product, it's not a veterinary diet, but it's one step more than maintenance. So in that sense, for example, we have a range that it's called sensitive for cats. We have one product for sterilized and one product for non-sterilized cats. That even it's not, or although it's not a diet, we try to take care of those cats that they have some difficult digestion. So in that sense, we are using only salmon. We are avoiding any protein that can cause any sensitivity on the stomach. And also we are reinforcing those functional ingredients that will be very useful for these kinds of cats, like omega-3 or omega-6 fatty acids to reinforce the skin and coat. Or also we try to avoid any other ingredients that we know that they have a huge risk of having allergies, like for example, egg. So here you have another example how even for maintenance products or for non-vet diet products, we try to adapt all our formulas to them. So here you have the full portfolio that we have for dogs, not vet diets. Those products are not vet diets. So in that sense, we have 4 products for puppies, 3 for adults, 3 for seniors, depending on the age. In the case of dogs, we adapt all our diets for mini dog, medium dog, and maxi dog. And then we have the sensitive range for dogs, the light range, and also the breeds. And when we move to cats, we are dividing them between sterilized cats and non-sterilized cats. In the case of sterilized cats, we have junior, adult, senior, and also sensitive range and herbal. And for non-sterilized cats, we have kittens and adults. So this is the range of products we have for cats, apart from the veterinary diets, right? Then we move to the palatability. Palatability is, as I said, it's the key, especially with vet diets. So in that sense, we have a nutrition center that it's near Barcelona, and there we have more than 300 dogs and cats, and there we run every week different palatability tests. So our objective is to have the highest palatability we can. So that's why I encourage you to try the vet diet, because for sure the palatability has been checked and rechecked a lot of times. And I think that in not 100% dogs and cats, because it's quite difficult to be sure, but at least 95% of dogs and cats will not have any problem of palatability. And the science. So we have that nutrition center in the company, but obviously there we cannot run everything. So we have to collaborate with universities around the world. We are lucky because we have the Barcelona University very near here. So there we have a lot of groups that help us a lot. But for sure we have to move also far away to sometimes to collaborate in different studies to test, especially the vet diets that well, they are not so easy to have the right formula to prevent or to control all the diseases. So here you have two examples about science we are doing. So we are not only investigating nutrition, we are also investigating different things, let's say, about the health of dogs and cats. For example, here we try to investigate as much as we can the microbiota to understand how is moving this microbiota in dogs and cats. And with this big knowledge about that, we can for sure formulate products that are better adapted to dogs and cats. And finally, we have that website. I encourage you to enter there, because in that website you have plenty of technical information for your daily work. So here you have two examples of research reports about urinary problems in dogs and cats. So well, this is a platform that it's free for all of you. So I think that it's a good opportunity to search for technical science that we have behind. So as a summary, why advance? I think that if I have to share with you some home messages, I would say that the first thing is the fresh meat as the first ingredient. So I think that we are almost the only brand that is using fresh meat as the first ingredient, and we are fully confident to use it like that, because this fresh meat has a real high quality. The second thing why advanced is that we are including functional ingredients, especially active defense with probiotics, prebiotics, and fibers that are pushing the healthy microbiota. Obviously, we are adapting the diets or the products to all pets. We have strong science behind, so anything you need to know about our products, anything you need to see the science, we can share with you without problems. In fact, a lot of things are already shared in that website that I show you. And finally, one thing that is very, very important is the palatability. So as I said, we have a center where we run the palatability every week. And for sure, we are improving as much as we can. So this is the let's say a general overview about the brand. I will take advantage of this presentation just to mention the urinary diets we have. So as Xavier said, urinary diets are quite important in the sense of prevention or control urinary problems. So it will be just a few slides, but I think that it's quite a good opportunity to share with you which diets we have. So in the case of dogs, we have urinary, let's say normal urinary for estrobite and oxalate calcium stones, and we have urinary low purine for other kinds of stones. So it could be like, I think that you in your market have like Hills UD, I think. So just to have the similarities. For sure, urinary diet, the pink one, will be used in almost all cases, because this one is the one for struvite and oxalate calcium stones. So these stones are much usual in dogs, but also you have the option to use urinary lopurine if you have other kind of stones. So as I mentioned, well, and Xavi mentioned too, is that struvite and calcium oxalate stones are very, very usual in dogs. So in that case, we have the urinary diet, but for the other ones that they are normally around 10% of the stones, we have urinary lopurine, that it's the green one, let's say, for those kind of stones. So both diets are adapted to the special needs for that. So especially for the urinary diet, we have to take care of the urinary pH to avoid struvite stones. So we have to reduce the urinary pH, but also we have to include some crystallization inhibitors to prevent the calcium oxalate stones. In the case of urinary lopurine, it's working quite different. So in that case, the pH has to be higher than with the urinary diet. So in that sense, because of the stones, we have to manage the pH in the other sense. And also for both of them, we have to take care of the level of minerals in general, but also for both of them, we are trying to at least to maintain the high quality protein, maintaining the high quality origin of this protein. So here you have a very a picture that it's quite easy to understand when to use one or another. So here also we have to take into account the renal diet. So sometimes renal diet is also an option. So I will not go into detail now with the renal diet, but it's true that for some stones, at the end, for all of them except struvite, we can also use renal diet. So here you have a clear picture about which diet, urinary diet, we have to use depending on the kind of stone. And as I said, we are relaunching the brand. So in few months, these new products will arrive to Malaysia. So until now, we still have the let's say the old one, but for sure I hope in the next month the new ones will arrive to your clinics. And in the case of cats, because urinary problems in cats are more usual than in dogs, we have 3 products. So the urinary range in cats is a little bit bigger than compared with dogs. So we have the standard urinary sterilized low calorie for those cats that are sterilized, and urinary stress. So here the thing is that urinary problems in cats are not so frequent if we see in terms of percentage, but the thing is that the recurrence is really, really high. So sometimes a lot of times they are eating a urinary diet for the whole life. Here there is an important thing is that, and this is different from dogs. In the case of cats, we have seen that glucosaminoglycans, they are present in the urinary barrier. So and this urinary barrier is somehow not healthy in idiopathic cystitis. That is the most common urinary problem in cats. So in that sense, we are including these glucosaminoglycans in the diet to reinforce that this urinary urothelium and trying to prevent them to have idiopathic cystitis. So this is something that is especially for cats. This is not present in the dog urinary diet, because we have seen that this is a special thing that is present in cats. So as I said, we have the standard urinary, the one that is for struvite and oxalate and calcium oxalate stones. Here you can see in the diet that we are including glucosamine and chondroitin, that are those glucosaminoglycans that will reinforce the urinary barrier. And for sure, we have in general to be aware of the level of minerals to avoid any crystal stone. Then we have the urinary sterilized low calorie, that it's the same, but because of cats, a lot of cats are sterilized, at least in general. We have this diet that it's completely the same, but with less energy. So this diet has less fat and less fiber. And this is for those cats that are sterilized and they have urinary problems, because moreover, these 2 problems are really related. So those sterilized cats, they tend to have more urinary problems. So for sure, we have to have an adapted diet for those kind of cats. And after that, we have another option that is urinary stress with some ingredients that are reducing the cortisol levels. So we know that these ingredients are reducing the stress these cats are suffering. Also, the idiopathic cystitis is somehow related with stress and on the other way. So this is an option for some patients that or some pet owners that they want to use this kind of cat, especially for those cats that are at home and they are a lot of time alone suffering from that. And again, when to use each diet, it's not difficult, but you have plenty of technical information in the Vets and Clinic website. So here you have an example about how to use all diets we have. Again, here, renal diet is also playing a role, depending on the kind of stones or diseases the cat has. So I encourage you to go to the website and see all these materials that for sure will help you. The same, we are relaunching the run, so I hope in the few months you will have the new diets in your clinics. The concept of the diet, it's not changing a lot, but we are doing some light improvements in the formula to have even better results. And finally, to finish, we have here, you can see all the bed diets for dogs. So we have the topic range for atopic dermatitis, hyperallergenic for allergies, gastroenteric, weight balance, diabetes. We have the articular range, renal product, urinary, and urinary low purine. And for cats, we have the 3 products for urinary problems that we have been talking about. We have the renal diet, the weight balance diet, hyperallergenic, and gastroenteric. As a summary, I would like to say that Advance has an innovative formula, especially with after the relaunch. And for sure, the one thing that it's quite different is that we are using fresh meat as the first ingredient. Also, we are including probiotics, prebiotics, and fibers to reinforce the microbiota. We have a strong science behind and also a huge palatability to help dogs and cats to eat the food, especially those veterinary diets that sometimes are not likely to the dogs and cats. We have the complete portfolio in the sense that for maintenance products, we are adapting to all kinds of dogs and cats, and for the pathologies, we are adapting to almost all the pathologies you can see in your clinics. In the case of urinary diets for dogs, we have 2 products, urinary for erythrobyte and calcium oxalate stones, and urinary low purine for those other stones. And in the case of cat urinary diets, we have 3 products, and they have glucosaminoglycans that it's somehow new to reinforce the urinary barrier and reduce the risk of idiopathic cystitis. So that's all from my side. I think that now we have time to some questions to Xavier and to me.
Yes, we do. I've picked like 2 questions because actually we are running out of time. But
Okay.
once again, thank you so much, Dr. Alba, for your presentation. I hope it gives our audience today like an idea of what Advance is all about. So thank you so much, Doctor. So I will read out 2 questions. So the first question is, are there other methods or tips that we can advise pet owners to prevent crystalluria reoccurrences besides prescription diet, weight loss, and increased water intake?
I think that maybe this question is more for, okay.
Yes, no. There is not this is one of the main ideas of my talk, no? You need to make an individual recommendation in each case. So it depends of the kind of crystalluria that have, the breed of this dog, the situation at home, style of life, kind of food that like the dog or the cat in dry or wet. There are many other factors. Of course, all the factors, the predisposition factor, I think is my third slide, and we talk about predisposition factor. All the predisposition factor, it could be reduced, improved. So if we can decrease the quantity of crystalluria, independent of crystalluria, this will be nice. If we reduce the urinary specific gravity, this could be maybe the most easier and less frequent done by veterinarians. So we need to pay more attention, for example, in obese dogs or obese cats, of course, increase the exercise. No, in the dogs is more easier. In the cats, probably doing some environmental enrichment and maybe make some consultation with behavior veterinarian. So there are many options, and the important thing is not lose the objective, decrease the supersaturation, relative supersaturation index.
All right, thank you so much, Dr. Chawi. So maybe we can get another question then for Dr. Chawi to answer. If the patient's urinary problem has resolved, like they have to still continue on prescription diet, or they can switch to a normal diet?
Again, it depends of each dog or in each cat. No, if you can use other kind, or you need to use other kind of diet, for example, because the dog or the cat have another problem, or maybe you want to come back to a not prescription urinary diet, you can try. It's just to control. The important thing is to control. So you can try to use another kind of diet. In this kind of diet, with the controls, evaluate the urinary specific gravity, the quantity of crystals or not, again, the pH, other these things. And with these controls, every several months, depend of each case and depend of the veterinarian, you can decide if this change could be fine or not. So most times it's not a problem to come back to if we don't forget what are the problematic of the urolithiasis. So we need to use more several times. You can use another diet, but for example, use in the sense to increase the water consumption of the different dogs and cats in order to decrease the urinary specific gravity.
Okay, thank you, doctor. I think we'll just wait for Dr. Alba for a minute. Okay, so we will proceed with the Kahoot first. So the balance questions, and there are only 5 questions on the chat box. So if our audience here today,
can you hear me?
Yes, we can hear you.
Sorry. Oh, now? In fact,
yep.
Okay.
Doctor, we will actually proceed with the Kahoot first. So the other questions, like we will actually proceed them to the audience. So for the audience, if you have like more questions, you may actually put it up the chat box and we will email back the response to you. So we will, to remind everyone, we have a Kahoot session now. So as usual, the first 3 winners will actually get a gift, and this time we've prepared Grab vouchers. Please put your actual name when you're playing, because it's easier for us to track back to give you the Grab voucher. All right?
Okay, so I will, can you hear me, right?
Yes, I can hear you.
Okay, I will start the Kahoot, so you will see like a QR, so you can scan the QR, or you can go to the website and then put the numbers you will see on the screen, right?
Yep.
It's loading. Can you see the screen?
Yes, I can see the screen.
Okay, so you can scan the QR, or you can go to that website, kahoot.it, and then put the PIN.
So you can use your handphones to actually scan the QR, or you can put in the PIN, and please put in your actual name. Please put in your actual name, guys. I can see someone here with E.
So you will see each question has 4 answers. So you will see that each answer has a color. So in your mobile phone, you have to click on the right answer. It's just one right answer for each question. We have 71 people right now.
Okay, I think almost half of them are in already. Okay, I think we should just continue. Dr. Alba, is that okay?
Yeah, for sure. So as I said, you will have in your mobile phone like 4 colors, and each color is an answer. So you have to click on the right one. So I will start, right? It's more and more people, but we have to start. Yeah? Yes, it's
Okay.
fine. Well, we can wait 100 maybe.
Oh yeah, let's wait for
Oh, no,
100.
it's okay. Okay,
Okay.
we can start. We can start.
Yes.
So you have to click on the right color. 10 seconds. Okay, so there are 34 people that they have click on the right one. So here you can see the who is winning after each question. So you have to be fast. Okay, so half of the people had the right answer. Well, we have one big climber. The third one. Quite well. Okay, so here you can see if you are on the list or not. Okay. So well, here you have to be really fast because the first answer it gets more points. Well, we are in the, I think we are in the middle. Yeah, so oh, this is a big discussion. Yeah, the red one is the red one. So, well, three questions to arrive to the end. So, well, here there are many answers that are not on the right one. Okay. It's somehow difficult for me to pronounce the names, but you can see who is in the first three positions. So I think this is the last question related with Xavier's presentation. Oh, this is quite good. So the two last, but they are related with advance. This is quite easy. My questions are easier than Xavier's ones. Okay. And the last one. Okay, this one was a little bit more difficult. So we are at the end. So let's see who are the first three people. Oh, well, here it's the first 10. No, this is the first, the three first. So here we have the winner, that it's Alisa Shamira.
Correct. Alisa Shamira. Correct.
So thank you to everyone to join the game and to be connected to that webinar. I hope you like it. And well, any question you have, for sure you can share with Thanusha, and Thanusha will share with me and Xavier, and we will answer. Thank you very much.
Thank you. All right. So the winners, just do us a favor by putting your name in the chat box once again, your full name. And for the rest of you, you can actually go to the chat box. There is actually a link where it's a survey form. So once you fill up the survey form, you will actually get your certificate and your CPD points.
Okay.
All right, so while doing that, I would like to thank Dr. Chawi and Dr. Alba for today's session. I'm pretty sure everyone here today actually got a lot of information, new information. So thank you once again for being part of our webinar for this month.
Thank you very much to all of you.
Thank you. All of you.
Bye-bye.
See you. Bye-bye.
Thank you. Bye.
Thank you very much.